Hi, I'm Helen, Immunisation Facilitator for the Waikato. We are going to show you 4 scenarios illustrating different aspects of vaccine conversations that you may encounter in your practice. In this scenario, Michelle is talking with a mother of an 8-week-old who has delayed the 6-week immunisations and remains hesitant about getting them done.
Hi.
Hi.
So this is Sam?
Yes, this is Sam.
And is this your little boy?
Yeah, and this is Yuan.
Hi, Yuan. How are you? Good boy. So if you'd like to come through with me and then we can have a chat.
Okay.
Okay.
Yes.
Can I take the pushchair for you?
Oh, thank you. Yeah, that'd be great.
Okay.
All right.
Hi, Yuan. How are you?
I'm good.
I'm just going to have a chat with your mummy for a little while. Is that okay? Good, good. So I've asked to have a quick word with you today. I just noticed you in the waiting room there. I noticed that Sam is how old now?
8 weeks.
8 weeks old now, yeah. And he's not had his 6-week immunisations yet, has he?
Yeah, no.
No. So I just wanted to have a chat with you about that.
Yeah. It's because he always seems to have a runny nose.
Okay.
And you know, that vaccine, the vaccine in the mouth, I've heard that it causes an awful diarrhea. So I'm thinking, does he have to have that?
Yes, okay. So with regards to the runny nose, he's not had to go back to hospital or anything since he was born. It's just minor illnesses, is it?
Yeah.
Having a runny nose or having a bit of a tummy bug or just being off colour is not a reason not to vaccinate babies. The problem if you don't vaccinate them is that they're not being protected against disease. So you are leaving them exposed to diseases and bigger problems by not vaccinating them. We do assess babies to make sure they're fit for vaccines when they come in. So what we would do is take their temperature. As long as their temperature is not above 38 degrees C, then it's quite safe to go ahead and vaccinate them. So I would recommend that you get the vaccines done. Now, he should have vaccines at, I'll just show you, have you got this leaflet?
No.
You haven't? Okay, I can give this to you to take home. Just inside here, it's got the schedule. So the 6-week immunisations are the ones that I would recommend that we do as soon as possible. The next vaccines are due at 3 months. So as long as there's a 4-week gap here, we can give him these vaccines at 3 months and then that will get us back on track, so he'll be back on time. So the vaccines that he's going to have, you're quite right, they do get a vaccine in the mouth, which is the Rotavirus Vaccine. And that's, I think, the one you're talking about when you said about the diarrhoea.
Yeah.
Now, rotavirus is a disease that causes a very severe gastroenteritis, so they get diarrhea and vomiting, and it can be very debilitating. They can also get a really high fever. The other thing with rotavirus is it is very common. Most children will get rotavirus before they're 5 years old, but some of these children will end up in intensive care. Many children are hospitalised with rotavirus each year. The vaccine itself is a live vaccine, so we put the vaccine, it's a vaccine that goes into their mouth and they swallow, and then it works in the gut and it protects the gut. Now, there are a couple of side effects that are rare but possible with the vaccine. First of all, you're quite right, some children do get some diarrhea after the vaccine, particularly after the first dose. But you have to weigh that up against the risks of the disease. You know, rotavirus disease is much more severe diarrhea. The other thing that is really very, very rare, but again, it's a slight risk, is that the children, there's a condition called intussusception, which is a long word, but it means it's a particular type of bowel blockage. And with that, the incidence of that is increased very, very slightly with the vaccine. However, if you get rotavirus disease, it also increases the risk of having this blockage as well. So it's quite complex, but we still recommend the vaccine. The risks associated with the vaccine are much less than the risks associated with actually getting the disease. So it's a bit long-winded, but I have got a leaflet here, although it talks about rotavirus in here, this one talks specifically about rotavirus, so I can give you this leaflet as well. So, have you got any questions? Does that answer your query?
Yeah, I think that sounds good.
Okay. We can vaccinate Sam today. If you've got time, you do need to wait for 20 minutes afterwards. But if you wanted to, we could go ahead and vaccinate Sam today.
Yeah, that's fine.
That sounds okay?
Fine, yeah.
All right then, so I have to just go through a couple of things here. Oh, look at that, he's fast asleep. That's amazing.
He's asleep
well done.
now.
You and your brother was so good.
Yeah.
Okay, so I've filled in the immunisations here, and we've made an appointment for his 3-month immunisations.
Right.
So he'll be 3 months old and he'll be back on time then. So I'll leave that leaflet for you and the one on rotavirus, and I'll see you again in 4 weeks. Now, how old is Yuan?
He's turning 4 in 2 weeks.
Oh, right. So he's actually will be due immunisations at 4 years of age. So this is the primary course that we talked about. And then they have 15 months, which Yuan has had his 15-month immunisations. Yeah. So the 4-year immunisations are 2 injections. It can either be 1 in each arm or 1 in the arm and 1 in the leg. And it's diphtheria, tetanus, whooping cough and polio. So some of the stuff that was in here that he's already had. So this is a booster. And then the mumps, measles, rubella vaccine, which he had at 15 months. This is the second MMR vaccine that he'll have. So those are the ones that he'll be due in a few weeks' time. How was he after the last immunisations?
Oh, it was awful because he screamed the place down, and that's why I'm worried now because he's due soon.
Okay.
Yeah.
There are a couple of things that I can recommend that you do to try and make that a bit less traumatic for both of you when next time round. First of all, I would actually talk about it at home. So you might want to have a toy or a doll or a teddy bear or something and play doctors and nurses, and have a nurse giving the injection to the baby and talk about vaccines. And try and just normalise it and bring it in as a normal part of play. And then when you don't say it doesn't hurt, because it does. So just talk about, it's going to be sharp but very quick, or pretend to inject the baby, and don't, you might cry, or so just try and normalise it. That would be one thing to do. And then when you bring him in, tell him that he's coming for his vaccines or for his immunisations. And bring a toy, or talk about something that you can do afterwards. Maybe, you'll take him to the park afterwards to play on the swings or something like that. And then when he comes in, we've got bubbles and things here that to distract him. And then we can use some techniques, like we can sort of press on the limb where we're going to pop the needle in. We just press on there first, and that can also help reduce some of the pain. So I'll be pressing on your arm like this. That doesn't hurt, does it? It does. Okay, so you can try some of those things. Now, on the IMAC website, which is designed for parents to give them information. Have you got internet at home?
Yeah.
You have.
Yeah.
If you go to this website, you can get a leaflet on there called Tips for Immunising Your Children, and it talks through. If you've forgotten what I've said, there's some really cool ideas there about what you can do to immunise. Bring in a favourite toy. If he's got a favourite toy, bring that with you, or even his dolly that's having the immunisations or something. That would be really good. And you be really positive. That's really key to it. So if you show that if you're nervous and show that, then that will make him nervous. So does that help?
Yeah, that helps.
Okay. So we will see you in for Sam's 3-month immunisations, and I'm just thinking we could do Yuan's at the same time, because he'll be 4 then in 4 weeks' time, will he?
Yeah.
Yeah. So we could. Do you want to do them both at the same appointment?
Yeah, we can do that. That'll be easier.
Okay, so I'll make the appointment for a bit longer, and what we'll do is we'll do Yuan first, because we don't want him to watch his brother getting immunisations, and then so we do his
good.
first. How does that sound?
Yeah.
All right. Well, I'll just extend the appointment on the computer, and you'll need to write off, close on an hour when you come in for that appointment.
Okay.
Is that all right?
Yeah, sounds good. Plan.
Okay. Right. So you've got another. Probably about another 5 minutes in the waiting room.
Okay, cool.
I'll pop out and just have a look at Sam's legs before you shoot off. But you can go and play with the toys in the waiting
Let's
room
go.
now. Is that good? And I'll see you. You come back and see me in a few weeks' time.
Yeah.
Great. I'll see you then, Yuan. Okay
Alright,
then.
see ya.
Great. Bye bye.